A diaphragm is a barrier method of contraception that prevents pregnancy by covering the cervix and blocking sperm from entering the uterus. It is a dome-shaped, flexible cup made of silicone or latex with a firm, flexible rim. The diaphragm is designed to be used with the spermicide, a chemical that kills sperm, to increase its effectiveness. How a diaphragm works. The diaphragm is inserted into the vagina before intercourse, positioned to cover the cervix completely. It creates a physical barrier that prevents sperm from entering the uterus and reaching an egg, thereby preventing fertilization. The spermicide applied to the diaphragm before insertion further increases protection by immobilizing or killing the sperm. Usage instructions. To use a diaphragm, a woman must first apply a spermicidal gel or cream to the inside of the cup and around its rim. The diaphragm is then folded and inserted into the vagina, pushed back to cover the cervix. After intercourse, it should be left in place for at least 6 hours to ensure all sperm are immobilized by the spermicide. The diaphragm should not be left in for more than 24 hours to reduce the risk of infection. Effectiveness. When used correctly with spermicide, the diaphragm is about 88–94 effective in preventing pregnancy. Its effectiveness depends on proper placement and consistent use every time during intercourse. It does not provide protection against sexually transmitted infections (STIs). Using condoms in addition to the diaphragm is recommended for STI prevention. Advantages. Non-hormonal. Suitable for women who cannot or prefer not to use hormonal contraceptives. Reusable. A single diaphragm can be used multiple times, making it a cost-effective option over time. Control. Provides women with control over their contraceptive use without requiring daily attention. Disadvantages. User-dependent. Requires careful insertion and correct placement to be effective. Less effective than some other methods, higher failure rate compared to hormonal contraceptives or intrauterine devices (STIs). Possible side effects. Some women may experience irritation or allergies to the latex or silicone material or the spermicide. There is also a small risk of urinary tract infections (UTIs). Suitability. Diaphragms are suitable for women of all ages who are comfortable with using barrier methods and who do not have a history of certain medical conditions, for example, frequent UTIs, latex allergy. A healthcare provider usually needs to fit and prescribe the correct size of the diaphragm for first-time users to ensure effective use. Conclusion. The diaphragm is a versatile, non-hormonal contraceptive option that gives women more control over their reproductive health. While effective when used correctly, it requires diligence and practice to ensure proper placement, and it does not protect against STIs, making it best used in combination with other protective methods. Thank you for watched my video. Please subscribe my channel.